Welcome in the lounge. An estimated 1.2 million Australian had diabetes. This is based on the statistics on 2017 and 2018. الإحصائية دي بتبين لنا قد إيه إن مرض السكر بينتشر انتشار كبير جدا بين عدد كبير من الناس. ما نستغربش إن هو موجود بين الأطفال وبين الشباب وبين الكبار بالظبط. النهارده في الحلقة النهارده هنتعرف إزاي على إيه هو مرض السكر وإيه هي أنواعه وإيه هي الأعراض لمرض السكر وأساليب العلاج المختلفة لمرض السكر. تابعوا حلقتنا النهارده ويا ريت تشاركونا على سلايدو وتبعتوا لنا اسئله، وكل الاسئله اللي هتبعتوها لنا ان شاء الله هنطرحها على الجست ونحاول ان احنا نرد عليها. يسعدنا في البدايه نرحب بضيوف حلقتنا النهارده سبيشاليست رامي بشاي، اهلا بيك، ودكتور مارينا اسكندر، اهلا بيك. How are you? Diabetes is very common disease, but we need to know more about it. So Marina, you tell us more about what's a diabetes exactly?
Yeah, sure. So you're right, diabetes affects about 1.2 million Australians, which is a huge number. So kind of between 9 to 15%, like we were discussing earlier. So it's very, very common. And as you get older, it becomes more and more common, and the number of people who have it increases. Basically, it's a condition where the body can't use glucose or sugar properly, and because of that, the levels are higher in the blood. And that can cause a lot of different problems, which we'll touch on a little bit later. There are lots of different types of diabetes, but ultimately the issue is with insulin. So if you're not making enough insulin or your body can't respond to the insulin that you're making appropriately, then you run into problems with diabetes.
دكتور رامي، يعني احنا مارينا كلمتنا عن ايه هو مرض السكر بالظبط. انا عايزه اعرف يا ترى في منه انواع مختلفه، يعني what's a different type of الانواع.
So there's actually, not many people know this, but there's actually 20 different types of diabetes, and there's actually even more. There's a lot of them. بس هو في 20 نوع سكر. بس the most popular ones are type 1 diabetes, type 2 diabetes, and gestational diabetes. So سكر أولاني النمرة 2 وفي الحمل. The common one, particularly in people of Middle Eastern background, is type 2 diabetes, and as Dr. Marina was mentioning, that's one where you get, as you get older, weight and diet and lifestyle, which we'll talk about very soon, has a very important role to play in development of diabetes. In fact, you can almost stop diabetes if you change your lifestyle. Type 1 diabetes affects children and can affect, now it's actually starting to increase in adults as well, and that's when your body makes no hormone, the hormone called insulin. And insulin is very important to make sure our sugars stay normal. If the body doesn't make enough insulin or doesn't make it enough in appropriate amounts, then we get these different forms of diabetes. And we'll talk about pregnancy and diabetes, I think, later on, yeah.
So you talk about type 1, what about type 2?
So type 2 again is the one that's more common. That's about 85%. So 85% اللي عندهم السكر هي نمرة 2 نوع نمرة 2. No, not type 2 diabetes. Yes. Yes. Sometimes في الأطفال ساعات تحصل لهم كتير، بس now هي بتيجي في الناس getting older as well. That's when your body doesn't make any insulin or makes very little. Well, you need you need insulin to survive.
هو ترى necessary type 1 يكون ليك family history for example ولا doesn't?
Actually, that's actually the strange thing. Actually, it's more common to get a family history with type 2 diabetes. So very common, if your parents or mama or baba عندهم السكر, there's a high chance you might get it unless you change your lifestyle, okay, and you live a healthy lifestyle. But yeah, that's important. Whereas type 1, there might be one auntie, one uncle, maybe a parent, but it's much more common in the family history. يكون وراثة type 2 diabetes is very important, the genetics, yeah.
Marina, so you want to talk about the symptoms of diabetes. What's the symptoms? What can I feel that I know that I've got diabetes?
Yeah, so it's a good question. I think the first thing to kind of comment on is that a lot of people don't have symptoms that they notice. So you can have diabetes and just be completely like unaware that you have it. You feel normal. We'll come back to that in a second, because often what you'll find is when you go back and you talk to people, they'll say, oh, actually, yeah, I have been feeling a lot of these things. So we'll talk about that in a second. But the classical symptoms, the ones that for all of us kind of like, you know, light up in our brain, you're talking about like increased thirst. So being thirsty all the time, always wanting to drink water, going to the bathroom a lot to pass urine constantly, and being hungry all the time, feeling hungry all the time, that can also be a sign of diabetes. So they're kind of more severe signs. It means that you've probably had a blood sugar that's been high for quite some time, and that's your body's way of trying to normalize it and trying to deal with it. But a lot of the other symptoms are actually so much more subtle. So tiredness, lethargy, feeling exhausted, feeling like you just can't keep up is a really big one. Getting wounds on your skin that don't heal easily. For women in particular, lots of urine infections can be a sign of diabetes. Just feeling a little bit off, not feeling 100%. And that most of the time, that's what you notice rather than anything, major.
المعلومه دي مهمه قوي، حابه توضيح يعني اعراض مرض السكر ممكن زي ما قالت دكتور مارينا ان هي ممكن تكون very يعني ستريت فورورد، يعني اعراض واضحه زي الانسان بيحس بعطش شديد قوي في فترات طويله، محتاج ان هو يشرب all the time، محتاج ان هو ساعات ياكل كتير، محتاج قوي ياكل، ساعات يخش الحمام بالليل او في اوقات مختلفه كتير جدا، بيحس بارهاق عام برضو، وممكن لو في اي جرح او حاجه ما بيلتئمش بسرعه، ودي كلها دي اعراض للمرض السكر. في السيدات ممكن يحصل لهم نوع معين من انواع الالتهابات برضو، دي علامات مبينه بتبين ان ممكن الواحد لا هنا ممكن ياخد باله ويروح يتشيك عند the GP or his family doctor يتشيك us.
Yeah, that's right. But also that you could feel completely normal. You can feel completely normal and still have diabetes.
Is there a way, or can any diabetic person can have no experience, feel no experience, and still be a diabetic?
Absolutely, yeah, absolutely.
This is very scary.
It is.
What we can do
It is. So I think that's why we talk about, like, especially with your family doctor, with your GP, it's why we talk about screening and finding people who are at high risk. And so there are lots and lots of different things, but I'm going to talk particularly about type 2 diabetes right now and your risk of type 2 diabetes. So people who are over the age of 40, people who are overweight, particularly people who have a large waist circumference. So, a lot of weight around their tummies. A kirsch, yes. That's right, yes. Unfortunately, people who are of North African, Middle Eastern heritage are also considered to be higher risk of diabetes. And what Rami touched on earlier, people who have a family history. So they're particularly like your first degree family. So your parents, your siblings, your brothers or your sisters, they're also at increased risk. In women who've had diabetes in pregnancy, even if they've not had it at other time, that actually increases their risk over their whole life. And also people who have a poor lifestyle, so who don't exercise, who don't eat well, that also increases your risk. So we generally recommend for anyone over 40 that they do need to go and talk to their GP, and we can do a blood test to screen for diabetes, even if they feel okay. And it's because of exactly that. You might not realize, you feel like, life is normal, but there could be an underlying problem. And if you have any of those risk factors, we would probably screen you earlier.
نقطة مهمة قوي مارينا اتكلمتي عن ان ممكن يكون انسان فعلا عنده مرض السكر وهو مش عارف او مش مكتشف ده، اللي حاسس بنفسه انه عنده شويه اعراض معينه، او يعني ممكن يكون زايد في الوزن مثلا، ويكون في الوقت ده مثلا فوق ال40، يبقى بنرجح او ان احنا بنشجع الناس اللي هم فوق سن ال40 او اللي هم عندهم زياده في الوزن ان هم يحاولوا دايما يروحوا للدكتور المعالج ويعملوا نوع من العلاج او النوع من المباشره، او يتشيك فعلا اذا كان عندهم مرض السكر او لا عشان يعرفوا. ف that's very important point about the regular checkup. So just I want you to encourage everyone to have a regular checkup with the GP and to know exactly if they got diabetes or not. So how they can do it, or when exactly, how often they can have a checkup with the doctor.
So it's a good question. So if you don't have diabetes, so I'm only talking about if you do not have diabetes, basically, so once you turn 40, you would start off by getting a test done, and depending on your risk, we would do the blood test maybe every year, maybe every 3 years, sometimes even every 6 months. It really depends on the result. But it's just a blood test. It's not very, very difficult. It's very easy to do. It's not time, like it doesn't take a lot of time. All the time that you need is the time that you're waiting at the doctor's surgery, really. Not anything more than that. But it is so important because the earlier that we find it, the more easily we can treat it, and the better difference that we can make by, implementing things like diet and exercise, and hopefully avoid medication altogether.
It's a very important point, Dr. Rami. I wanna talk about how can we manage the diabetes with normal and basic ways in our life, or what's our role can do, or what the diet can do to manage the diabetes. Can anyone rely on a good healthy diet to manage it, especially in the beginning؟ يعني في البداية يعني ممكن أعمل مثلا، أبقى عارفة إن أنا عندي مرض السكر واكتشفته، لكن أنا بحاول إن أنا بدل ما آخد أدوية معينة أو علاجات، إن أنا أحاول ألتزم بأسلوب معين في الأكل، ألتزم بدايت معين. يا ترى ده إيه أهميته يعني؟
Well, Maggie, and this is a very important question. And a diet is the most important aspect of diabetes treatment. It's more important than injections, إبر وحبوب، كل العلاج كله. It's the number one. And this is not just me. من زمان عملوا big study في UK. جابوا thousands and thousands of people اللي عندهم السكر. And they compared them to lifestyle versus diet versus normal counseling, يعني diet, exercise, بس. And then some other people got medications. الناس اللي عملوا lifestyle اللي خسوا في الوزن وأكلوا كويس, they reduced their risk and they got diabetes by over 60% after 5 years. The people who did the tablets, about 38%. Okay, so that means lifestyle for me, that's diet, exercise, is very important. Now, what kind of diet is that? I think as a community, we're all eating, the food has changed. يعني look at back, ماما وبابا كانوا بياكلوا إيه من زمان؟ أكل مختلف خالص. I feel if you have diabetes, in this advice, don't generalize it لكل حد, بس اللي عندهم السكر خدوا بالكم من حاجة اسمه النشويات والcarbohydrates. It's very important. نقلل شوية من أنواع النشويات. هو العيش والرز، مكرونة وبطاطس، الحاجات دي بيرفع السكر بيزيد الوزن كمان.
في ناس كانوا تقول ايه العلاقة ما بين، معلش I have to stop، ايه العلاقة بين الكاربس وبين الشوجر يعني؟
When the carbohydrates, when ناكل carbohydrates بيدخل جسمنا and it gets broken down as sugar. So a lot of people say, دكتور أنا ما أكلتش برا, I didn't eat any bad food. I'm eating healthy food at home, but they might have a big portion of rice. They check the sugar, for example, it's very high. I always counsel patients اللي عندهم سكر قللوا شوية من النشويات. If anything, we should be eating a bit more vegetables. And not all kinds of vegetables, so things like potatoes and beans, they also increase your sugar, but they're healthier than, say, rice or having a lot of bread and rice, much healthier. The other thing is we try to, as much as possible, switch from white carbohydrates to brown. Like, I mean very brown, okay, not just a little bit brown. But keep in mind, my problem is I find in the Egyptian community, because it's brown, بياكلوا أكتر. دي كويسة يا دكتور ناكل شوية حط لي كوب 2 scoops of brown rice or 2 scoops of this and that. So it's very important that if you're going to change, you also reduce the amount. The magic number, to be honest with you, is 15. If you lose 15% of your body weight, لو خسيته 15% من وزن, يعني مثلا واحد قال لي عنده 100 كيلو وعنده سكر, I say lose 15 kilos and your diabetes will go away. يعني هتلغى السكر خالص. So 15 is a magic number. This is for people who have been diagnosed early on. لو استنيت سنين كتير قوي, forget it. You're going to have diabetes. هيقعد معك. But if you lose weight early, especially in the first 5 years of diagnosis, it can go away. That's very important. So diet is crucial.
الدايت ونوع الأكل اللي احنا بناكله بالظبط ده مهم جدا جدا إن هو يعالج أو على الأقل يأجل الإصابة بالسكر. وده السؤال اللي أنا عايز أسأله. لو في شخص ما عندوش سكر, ما عندوش مرض السكر, لكن هو بيحب الحلويات أكيد, هل السبب ده في حد ذاته ممكن يجيله السكر عشان هو بيحب الحلويات؟ ولا لازم يبقى في استعداد في الجسم او family history او any other؟
هو لازم هو طبعا في كده وفي كده, يعني نص من الدايت, so 50% from diet و 50% من الوراثة والجينetics طبعا. بس بصراحة in my opinion هي مش حكاية أنا بحب حلويات. الحلويات واحد بياكلها مثلا مرة في الأسبوع، مرتين في الأسبوع، أو كده شوية. The problem I think is the food we eat every single day in big quantities. Bread and rice. And also the biggest quantities, the biggest issue as well is our weight. That's more important, I believe. So the food you change, if it affects your weight in a good way, and I tell everyone with diabetes, increase protein, increase vegetables, and come down on the carbohydrates. Almost everyone loses weight and their blood sugars are flat and stable. يعني السكر بيتظبط على طول من أول يوم.
Sorry, I just have to stress more
Yes.
about the diet, and especially many people doesn't know that kind of food how contain exactly from sugar. Because some people think that the fruit you can eat whatever fruit they can eat, the sugar is limit in the fruit, comparing between the sweet things.
Yeah.
So, for example, some kinds of fruit, some people ask about the content of the sugar in some fruit. So some people ask about the berries or some kind of orange. Or what do you think?
Oh, we have a dietitian here, Michael, who's our cameraman for the day. I'll offload a little bit on Marina as well, but it's very true. I mean, looking at it from Mother Nature and God who gave us these fruits, just keep in mind that fruit is Mother Nature's dessert. You have to keep in mind that because, as you said, it's meant to be enjoyed as dessert. Everyone says, you know, all kinds of fruit are the same, but they're actually very different. We actually also know vegetables are not all the same. So, for example, grapes, watermelon, cantaloupe, any fleshy melon-type fruit is very, very high in sugar. But as you said, strawberries, all kinds of berries, to be honest with you, are actually very healthy. They have the lowest amount of carbohydrate content. Bananas, I say to people, just not a big, large banana. If you can have a large one, cut it in half. It still has a low, حاجة اسمه low GI يعني مش بيلع السكر بيعلي السكر بسرعة. But it usually tends to be an okay fruit. Apples, basically any small fruit if you can. But I always tell patients to try to limit it to 2. I don't know if Michael will disagree with me, but I just try to say 2 pieces of fruit a day as a maximum.
So I think it's everyone has to do his own research about the
Yes.
food and the vegetable and fruit and how the content of sugar in each one of
Yes.
them. يعني كل واحد فينا يحاول ان هو يعمل شوية أبحاث أو يسيرش about الفود. لو هو شاكك مثلا ممكن يكون النوع ده من الفاكهة ممكن يزود له السكر، أو النوع ده من الخضار أو النشويات أو كده ممكن يكون له تأثير عكسي على زيادة مرض السكر عنده. لو هو ممكن يكون بياكل بطريقة مختلفة وبيستغرب إن هو ليه ما فيش تحسن في العلاج، لأن هو أكيد بياكل أكل مش صحي، أو maybe معلوماته عن الأنواع اللي بياكلها مش مظبوطة.
Can I just add that if you are diagnosed with diabetes, actually the government has like a program basically where you could see a dietitian or see a diabetes educator who can help you understand like what foods are good for you, what foods are bad for you, what will help you. And so all you have to do is talk to your doctor about it and they can organise that for you. But again, if you have diabetes, so not so much as a preventative measure, but definitely more once you've been diagnosed.
Actually, the diet is very important for everything, all kinds of diseases related to the heart diseases as well, and everything.
Yes.
So if we can succeed or manage what to eat, how to eat a good healthy meal, this can prevent lots of diseases and lots of complications.
Absolutely.
Yeah. Marina, if I would like to speak about the diabetes, or the patient had a diabetic patient, he needs to know more about the complication of diabetes. Is there a complication, or is there going to be
Yeah, actually diabetes is one of those things that kind of, I remember even as a medical student, it like strikes fear in your heart because it really has a lot of different complications. I will start off by saying that if your diabetes is well controlled, if you're doing all the right things, like you're eating well, you're exercising, you're taking your medication if you need it, you'd greatly reduce your risk of developing the complications. But also the longer you have diabetes, the more likely you are to develop the complications. So we split the complications kind of into 2 groups. We talk about complications that happen because of the effect of sugar on the small blood vessels, and we call that microvascular disease, so all the small blood vessels. And in that group we talk about kidney disease, and actually diabetes in Australia is the leading cause of kidney failure in all of Australia. And at its worst, what that looks like is, needing dialysis, so غسيل دم. But at the minor stages, you might not really notice very much. It might just affect what medications you can take, how often you can take them, and that kind of thing. But it can be very, very serious very quickly. The other thing that we talk about with the small blood vessels is your eyesight. So basically you can find a pattern when you look at the retina, so the back of your eye, where you get a lot of damage to that, and that can actually ultimately lead to you losing your sight. And so one of the things that we do with people who are diabetic is we encourage them to get regular eye checks with either an optometrist or an eye specialist called an ophthalmologist. And then the last one, when we talk about the small blood vessels, is actually damage to the nerves in your feet and your hands. And that can present in lots of different ways. Sometimes it's just like a really severe burning type pain in your hands and your feet, and it tends to be both hands and both feet. Sometimes it's numbness, completely, you just go numb, you can't feel anything. And that can be very dangerous because people can injure their feet in particular, more so than their hands, and not notice, or develop ulcers on their feet. And because the ability of the skin to heal is already impaired, it's like not so good in diabetes, then you can run into really big problems with infections and things like that without even realizing that that's happened to your feet. And so foot care becomes a really important part of like taking care of your diabetes. And again, your doctor will check up on that regularly, and we involve podiatrists as well to try and help you with that. So they're the small blood vessels. And then we talk about the big blood vessels, so your heart, so it increases your risk of having a heart attack and heart disease. Your brain, so it increases your risk of stroke. And again, your feet and the arteries that supply, the blood vessels that supply your feet, they can also get narrowed and blocked. And actually, again, diabetes is now the leading cause of having to have like an amputation, like having your foot cut off because of impaired blood supply. Diabetes is the main reason that happens if there's no like injury or anything like that. So it's very serious. It's not just a matter of, oh yeah, my sugar's a little bit high, I need to lose a little bit of weight. It can really, really affect your life. And so control of your diabetes is the single most important thing that you can do to prevent developing those complications.
As you said, that the complication can affect many organs.
That's right.
Bodies.
That's right.
Not only just
No.
Yeah. Anything.
That's right.
Yeah. So can the diabetic patient avoid this complication completely, or it's going to be happening in one stage of his life? Just like what he can do as a complication or delay it as well?
To delay it, really, it's diet, exercise, and taking the medication that you need to take, as well as making sure that you see your doctor. So whether that's your diabetes specialist, your GP, your eye specialist, your kidney doctor, like having a regular cycle where you see those people, and you have to see them frequently. Sometimes as often as every 3 months. That is quite frequent compared to how often like a person without diabetes might see a doctor.
دكتور مارينا اتكلمت عن المضاعفات اللي ممكن تحصل لمرض السكر. الحقيقه مضاعفات كتير قوي بتصيب كل جزء تقريبا في جسم الانسان. الانسان لو ما اهتمش قوي بعلاج مرض السكر، او ان هو ياخد العلاج في مواعيده، او ان هو يتبع غذاء صحي، او ان هو يمارس الرياضه، اكيد بيحصل نوع من المضاعفات دي بتاثر على العينين وعلى الكبد وعلى القدم مثلا فور اكزامبل، او كل اعضاء الجسم ممكن نلاقي فيه، او القلب كمان ممكن نلاقي فيه مضاعفات بتشكل الجسم كله. عشان كده دكتور رامي، انا عايزه اتكلم تاني عن اللي ممكن في ايدين اي مريض السكر ان هو يعمل. احنا اتكلمنا عن الغذاء الصحي او الوجبه الصحيه او الدايت المناسب الصحي اللي ممكن الانسان ياخده. مهم قوي كمان ان هو يهتم بالاكسرسايز. How is the exercise gonna be?
كل واحد لما بيفكر في اكسرسايز بيفكر في الجيم، دي مشكله. انا شيل منكم الفكره دي بتاع الجيم. اوكي، المهم الجيم كويس عشان نبتدي بيها. It's good to get exercise in the beginning if you need the motivation. هذه كده يشجعك شويه، بس بعد كده you can't be in the gym 24 ساعه. You can't be doing 24 hours a day.
في ناس بيبقوا كبار في السن.
بالظبط.
عندهم سكر، في ناس كبار في السن ما يقدروش
بالظبط.
يمارسوا كل الانواع.
Sure. Hey, Marina, I think Marina, you've got some answers, but hey, the Australian National Medical Council, it's the government that recommends we do about 45 minutes of anything every day. 45 minutes, 7 days a week. يعني ساعة إلا ربع كل يوم. Or if you're going to do Monday to Friday, about 1 hour. And that could be anything from a walk, swimming, even if you're walking around in the shops, which no one's really doing much nowadays, or you're trying to avoid it. But the exercise physiologists call it الدكاترة بتاع الرياضة بيقولوا لنا دلوقتي any form of exercise. Do you agree, Marina?
Yeah, absolutely. Yeah, it's whatever. I always say to my patients, like, it's whatever you can do, whatever is easiest for you to incorporate into your lifestyle. Do that, and it's just aiming for, like, you know, starting with small amounts and then increasing from there. But some movement is better than no movement, and if you feel like you can't commit to 45 minutes, 30 minutes is better than nothing. 10 minutes is better than nothing.
Yeah, that's right. So what we as Marina was saying, we normally start with 5-10 minutes walking around the block, especially if you're elderly. You don't want to go too far. I always also say there should be another plan just in case it's bad weather. If it's raining, لو في مطر or جو مش مناسب, there should be a treadmill or a bike or something else or a stepper you can use. And we try to increase it by 5 minutes every single week until we get to at least about 30, maybe 40 minutes. But please make sure you talk to your doctor or a physio. لو عندك مشكلة في الركب ولا الظهر ولا في حاجة مشكلة, make sure you speak to a physio.
Okay. هنكمل كلامنا بعد الفاصل إن شاء الله ونشوف بعد كده إزاي أساليب العلاج وإزاي ممكن نحمي نفسنا. نشوفكم بعد الفاصل.
Just not used to it.
With love over my sins, as you light up within me, I still look outside for thee. I have searched in every corner except those inside my heart. Oh, let me not fear to be alone with thee. I wait on the Lord to make glad my heart. I wait for your gifts, oh Holy One. I say, wait on the Lord. You have brought me out of comfort to cross high mountains and seas, got to leave all my needs behind and proceed to the land you promised me. I won't stir up nor awaken love until it pleases thee. As you wait with me, I'm trusting still, but you're now when you are here. I wait on the Lord to make glad my heart. I wait for your gifts, oh Holy One. I wait on the Lord to make glad my heart. I wait for your I say. As you light up within me, I still look outside for thee. I have searched in every corner except those inside my heart. Oh, let me not fear to be alone with thee. I wait on the Lord to make glad my heart. I wait for your gifts, oh Holy One. I say, wait on the Lord. You have brought me out of comfort to cross high mountains and seas, got to leave all my needs behind and proceed to the land you promised me. I won't stir up nor awaken love until it pleases thee. wait with me. I'm trusting this too, between now and you are here. I wait on the Lord to make glad my heart. I wait for your gifts, oh Holy One. I wait on the Lord to make glad my heart. I wait for your gifts.
Yes.
They can't understand the healthy food and vegetable.
Yeah, it's true. It is very hard.
We have a lot of
If you can
experience.
advise.
Yeah, we have a lot of experience.
Yeah, it is very hard. I agree. There are definitely programs out there that can help parents. But I think before we talk about that, I think the first step really is, especially with your type 2 diabetics, with kids who may not be at their healthiest weight, is first of all recognizing that there's a problem. Because I think, and I'm not just talking about like Egyptian culture, but like as a whole, as a country, we've actually lost our ability to identify which kids are overweight, which kids are underweight, and which kids are normal. Most people, when they're shown a photo of an overweight child, will identify them as an average weight child. So if you're told that there's a problem, I think you need to kind of be accepting of that and work together with your family, work together with your GP, with whatever specialists are involved, to try and understand and educate yourself about how you can do better, how you can offer more options for your kids. Healthy food doesn't have to be boring. There are so many amazing resources out there now about, you know, how to make healthy food fun for kids. And then we talk about programs. So the biggest one in New South Wales is actually called Go for Fun. It's a 10-week program. Things are obviously a little bit different now because of coronavirus, but they are still running it online. Essentially what it involves is you get 10 sessions, normally after school. They're completely free, completely funded by the government. It targets kids between 7 to 13 years of age, which I have to say I think is probably one of the more challenging ages to deal with. I think when you've got toddlers, to some extent, you have a little bit more control over what they eat, to some extent. But basically what the programs involve is like you have group sessions where like the parents and the children meet with a dietitian, with like exercise physiologists often, that kind of thing, and they go through what they can do together as a family to promote a healthier lifestyle. And then they'll kind of split into two groups after that. They'll have a session for the parents where they educate them and they help them understand what kind of food options they can offer their kids, how they can get them more motivated. And then they have like an active session for the kids for about an hour. And that goes over 10 weeks. The other thing I think is that we focus a lot on what we should be eating, which is probably the most important part, but the second most important part, which we also neglect, is getting your kids out and moving. So Rami mentioned no more than 1 hour of screen time. I know like it's so easy to put your kids in front of an iPad or a TV. Sometimes it's just out of necessity, that's what you need to do. But trying to find ways to do active things together as a family, you know, go out and go to the park, get on your bikes and go for a ride, play a game of like soccer in your backyard, anything to encourage them to be active. Because that makes a very, very big difference to their weight. And our kids are not moving enough these days. They're all quite sedentary. I mean, so are we as adults, but if we don't implement those values in our children when they're young, it's very hard for them when they're like in their 20s and 30s to ask them to start becoming active then.
يعني هي مسؤولية كبيرة قوي عن الآباء الأم والأب إن هم يحاولوا يغيروا الأسلوب الحياة اللي بيعيشها الولاد والأطفال. هم مسؤولين عن أطفالهم، مسؤولين عن الأكل اللي بيقدموه للأطفال، ومسؤولين كمان عن اللايف ستايل اللي بيعيشوه، مسؤولين إزاي إن هم بيتحركوا وإزاي بيلعبوا. مش أنا عشان أنا مشغولة أقدم لهم بقى التلفزيون والآيباد علشان أنا مشغولة بعمل حاجات. فهو الأم والأب الحقيقة ليهم مسؤولية كبيرة قوي يقللوا من أو يغيروا الأسلوب حياة الطفل عشان هو يقدر يتغلب على مرض السكر لو هو عنده. Dr. Rami, can the diabetes occur during pregnancy?
Yes. In fact, it occurs a lot in pregnancy. About, as I mentioned, there's في نوع الأولاني type 1, نوع نمرة 2 أو type 2, وفي diabetes في pregnancy. والdiabetes في pregnancy ممكن يجي بس في الحمل وبعد كده بعد الحمل goes away. So it can happen in pregnancy, and then after pregnancy it goes away. And there's one where if you have diabetes before you get pregnant and you get pregnant, that's very, very difficult to treat. So if you have diabetes and you want to get pregnant, inshallah يعني ربنا يديكم يعني, but you need to get treatment early on. I have a lot of women, I give preconception counseling, try to get down to the ideal weight, the healthy lifestyle, the exercise before they even consider having children.
Oh, okay.
Even the form of diabetes that you get in pregnancy, the gestational diabetes, that's what they call it, that's usually diagnosed on a sugar test. If you're pregnant, your doctor, your GP will get you to do a sugar test at around 26 weeks. pregnancy. That will diagnose gestational diabetes. Sometimes we have to do this test earlier for different women. But if it's positive, normally we treat it with lifestyle. First, the same things we talked about, and we send them to see a good dietitian. Sometimes you might need tablets, particularly one called metformin or Diabex. حاجة اسمه برضه diformin كمان, that's the other name for it. And sometimes insulin is needed, especially if it's very difficult to treat. After a baby is born, normally the diabetes will go away. However, your risk of developing الخطورة ممكن السكر يرجع تاني is up to 30 to 50%. يعني لسه السكر ممكن يرجع تاني in the next 10 years.
Okay.
So we always tell women, if you've had gestational diabetes and babies come, alhamdulillah, yani thankfully, hopefully you had a successful pregnancy, that the diabetes can come back still. So yeah, your risk is high. And that's a very important time to intervene, get them to see the GP and get the screening done, make sure they don't get it, and all those things that we talked about are implemented early before a woman or a mother who now has, young children to look after gets diabetes herself.
Exactly, yeah. So Marina, as Dr. Rami said, that they need the regular checkup during the pregnancy. Is there some sort of treatment during the pregnancy? And another question, is it necessary to be affected the newborn to get diabetes or not?
So it can affect the newborn, but not. It's a two-part answer. So I'll ask the first part. The first part first, which is can you treat it in pregnancy? And absolutely yes, just as Rami just said. We always try diet and lifestyle first, because if we can avoid giving you medication, then we will. And then the next step is either something like metformin, so a medication, a tablet that you take, or insulin. And actually, more than any other time in life, it may be a bit controversial to say that, because it's always important to have good sugar control, but it is incredibly important that you have good sugar control while you are pregnant if you have gestational diabetes, because yes, it can absolutely affect your unborn baby in lots of different ways. The first thing, the most noticeable thing, is that most women who have diabetes, who have poor sugar control, have larger babies, so bigger babies. And so we talk about like the 4.5 kilo mark. So those are what we call like bigger babies, effectively, or macrosomic babies. The problem with that is, like, yes, it's cute and sweet that you've got a really big baby who's chubby, but there can be lots of issues with delivery, and they're high-risk deliveries. The second thing that happens is when your blood sugar is high, that passes on to the baby. And so now the baby's blood sugar is high. And so the baby's default response is to make more insulin because it wants to lower the sugar. And then the baby's born, and the baby's still making a lot of insulin, but it doesn't have as much sugar anymore because it's not getting mum's sugar. And so the baby can have an episode of what we call hypoglycemia. So the sugar can drop very quickly, and they can get very sick with that if it's not recognized. The chances of that happening to the baby are much, much lower if your sugar control is good. Does that kind of make sense? So I'm not trying to, I'm not trying to scare anybody, but I think it's very important to realize that it's not just a high blood sugar in pregnancy and, it'll go away once I have the baby. It can have very, very real effects on the baby in that immediate term. Like, instantly you can see a difference in the baby. Maybe it's a better question for you, but I think there is some evidence that suggests that kids of mothers who have gestational diabetes are at increased risk of developing diabetes later in life, but I'm not 100% clear on the research.
Absolutely right, and I think Marina explained neonatal hypoglycemia, or low sugars in babies, very well. It's a very important concept. But you're absolutely right. You are at increased risk, not as increased risk as, say, the mother, but your risk is higher than the average population. To add to that, complications, again, hopefully we don't scare everyone, but babies can be born early, so you can get an early pregnancy, preterm labor. So الحمل الجيب بدري شوية. You can also get higher miscarriage, يعني ممكن البيبي يضيع منكم. And the third, you can get also heart problems, heart defects as well. And basically lots of things. You can either get really big babies, and sometimes in bad case you can actually get very small babies. It can affect the size. And the last thing I want to mention هو الضغط في الحمل. So you can get very high blood pressure. حاجة اسمه preeclampsia. الضغط يكون عالي قوي قوي. That's also usually بيجي مع سكر كمان. ساعات مش دايما but sometimes. Yeah.
Okay. Dr. Rumi, one of the question came, it's what's the effect of diabetes on prostate cancer? It's
Look, metformin has been around since the 1970s. Actually, Australia was one of the first countries to use it. Actually, we used it even before America did, because America, they used a form of metformin called fenformin, but it caused a lot of liver problems. But Australia said, we'll use metformin. Metformin was fine. Metformin, حلو قوي. Metformin actually is not only just good to reduce cancer, we know it reduces risk of colon cancer, سرطان القولون. It can reduce heart failure, it reduces fatty liver, and lots of other things it does. As far as prostate cancer, I'll be honest, I don't know the evidence for that. That's something for our viewers to research into. But if you do have prostate cancer and you have been on metformin, or you're worried about your risk, speak to your doctor. I think it's important.
Yeah, it's very good. Dr. Rami, maybe for our information, we need to know if we live with someone have a diabetic or a diabetic patient in the same house, we need to know some first aid or what we can do. So what's the aid we can provide for someone who has coma, for example, or low blood pressure?
So hopefully this doesn't happen to you.
Yeah.
Okay? If you have a low sugar or a coma, that this is bad treatment.
Yeah.
This usually happens لما في ناس بياخدوا علاج هو الانسولين إبر insulin بينزل السكر جامد, really reduces blood sugars, or another tablet called diamicron or اسمه glycoside.
Yep.
These are tablets. These two medications are usually associated. يعني بنشوف كده الناس ممكن السكر ينزل. يعني النمرة we need to remember the number we need to know is 4. Less than 4, hit the floor. If your sugar is less than 4, there's something wrong.
Oh, okay.
Usually people don't have a coma at 4, but they might go sugars. For example, if I give myself insulin and I forgot to eat, and then I go to sleep, and I could fall into a coma. This is a big problem. We tell patients, make sure you talk to your doctor and make sure that the treatment fits in with your lifestyle. Don't fit your lifestyle with the treatment. Yani just because you're on insulin doesn't mean you have to eat. If you're not going to eat, maybe you don't need your insulin, but you need to speak to your doctor and work that out. There is a medication called glucagon. It's ibra. If your sugar is low and you have someone, for example, on insulin, بياخد إبر, أو سكر you test the sugar and it's very low, less than 4, and they're not feeling well. And the symptoms of a low sugar هو إيه؟ هو حاسس كده دايخ, dizzy, sweaty, بيعرق كتير, ممكن القلب يجري بسرعة, جعان كتير, they're very hungry, or بيجيله صداع. If you're thinking there's a low sugar, you need to first of all give them you need to give them some carbohydrates. So you need to do one of 3 things. One, you need to give them a glass of juice, usually half a glass of juice, عصير, 7 jelly beans, or a cup of, a spoon of honey. Okay, right away.
Yeah.
And then the next important step, that's step number 1. Step number 2 is they have to check the blood sugar 15 minutes later. That's very important. Don't just give them the sugar and say walk away, because the sugar could still be going down and down and down. You have to make sure you check it again 15 minutes later. If the sugar is still low or less than 4, you have to do that again. Okay? If the sugar after 15 minutes أكتر من 4, then you can go on with what we call complex carbohydrates. يعني حاجات كده خلي السكر عالي شوية. هو a piece of slice of toast, يعني حتة عيش, موز, banana, or كوباية لبن, cup of milk. Okay. So it's very important you do that. Step 1, step 2, step 3. Step 1, again, check if you have those symptoms. Treat it with the jelly beans, the honey, or the juice. Check after 15 minutes.
Yep.
If you're still under 4, do that again. Go back to step 1.
Yeah.
But if your sugar is above 4, أكتر من 4, go down to the bread, the banana, or the cup of milk. Only one of these, not all 3. Okay. Just
very important information. You said that
yes.
If we live with any diabetic patient, we need to have at least a basic information.
Exactly. Yes.
Or how can we treat him in case if something happens.
That's right.
And we live with him as a first aid.
That's right. The first aid, though, if they cannot take anything because they've fallen on the floor and their sugar is very low, then what I said is the ibra, the glucagon pen, that will get their sugars up. But more importantly, you need to call emergency. You need to call 000 right away.
If you can't do anything, you need the safest thing. You call 000.
Yes.
If you're not aware what to do exactly. So this is Marina, we need to talk about the treatment. This is a good part, or we have to know what's a good treatment in each kind. So we need to talk about this for now. What's a treatment, non-treatment or advanced one?
So I guess the first line of treatment, so for anyone who comes in with us high blood sugar, the first thing that anyone's going to talk to you about is your diet and exercise. So that's the very first thing. And that, I think, Rami and I are really trying to push that point today.
Of hearing about
So this is part of from the treatment. We have to focus on this, stress on this, because some people thought that as long as I'm taking the medication, it's enough for me. I don't have to eat well or do exercise.
That is the most important part of the treatment.
You have to combine both of them.
Yes, and actually a lot of people will give a try, if your sugar's not, really, really high, we'll give a lot of people a trial of just diet and lifestyle first to see if they can bring their diabetes under control. And then we talk about, so we're talking only about type 2 diabetes at the moment, oral treatment, so medications that you can take. So Rami already mentioned metformin, and that's actually probably the first thing that we would try in the majority of people. It's very effective. It's good because it doesn't have that risk of giving people a low blood sugar, so it's quite safe. And we can use it in combination with other medications as well. And then if that doesn't work on its own, then we would add in other tablets. So there are lots of different classes of medications that we can use. I don't really know how much detail to go into.
There's a lot. It's very difficult to summarize it today, but I think the newer ones Marina's going to talk about.
So a class called SGLT2.
SGLT2,
inhibitors. And basically the way they work is to help your kidney get rid of sugar effectively. So it actually stops the body from reabsorbing that sugar again. And so you get better control of your diabetes because you're getting rid of the sugar without needing to make your body respond to insulin more, which is what metformin does. It increases your body's sensitivity to insulin. This helps you get rid of the sugar. And it's actually a really important class of medications for a few different reasons. The biggest one for me often is that it's got a very protective effect against heart disease. And that's, correct me if I'm wrong, but I understand it's actually independent of so on its own, it's got a protective effect against heart disease, which, because it is one of the biggest complications of diabetes, is very, very important. It can also aid with weight loss, and it can also protect your kidneys. So it is quite an important class of medication overall, but absolutely there are lots and lots of different oral options that we would use in combination with these medications. And then we talk about injectable medications, and I might hand that over to you.
I won't talk about insulin, but everyone is aware that there's insulin والإبر. There's lots of different أنواع insulin. كل شوية بيكون حاجة جديدة اللي comes to the market. بس أنا عايز أتكلم عن الإبرة المرة الأسبوع. There's two ones. There's one called Trulicity and one called Ozempic. These are medications made from hormones made from the stomach. So هرمونات المعدة. So هي حاجة طبيعية. It's natural, right? So you inject it once a week into the stomach, and it does three things. Number one, it reduces your weight because it makes you feel very full.
So this is once a week?
Once a week injection. It's basically the most powerful treatment we have for diabetes at the moment.
It has to be done by a doctor, of course. So can't
no, the injection you do at home. You give the injection. We teach you. I have 400, 500 patients on it. I just show them in 5 minutes. They do it and they go bye and they see it. And if they have any issues, they go see Dr. Marina.
Okay.
And I call you.
That's right. So they help you lose weight, they help bring the sugars down, and they also, like Marina's saying, these new class, this one also protects the heart and reduces the risk of جلطة or stroke as well. So بيعمل حاجات كتير قوي غير بس السكر بيساعد في الحاجات التانية. يعني on average people lose about 4 or 5 kilos on average, but you can even lose more. But it can make you feel a little bit sick. يعني بيشبع كتير. And sometimes people can feel a little bit sick, and sometimes ساعات إمساك ساعات إسهال, so you get some side effects. But only in the first few weeks. بعد كده جسمك بيتعود. For most people anyway.
So this is there any other advanced management treatments or This is the most having at
This
the
is
moment?
this is what we call the Mercedes, if I can say. There's a lot
That's
of
the
names
most
I've thrown.
quicker.
This is the Mercedes, the tablets, that Marina said, more like the Lexus, the nice car. What are the nice cars? Do you know of? I don't drive any of these cars. I can't afford them. We can talk about the other advances like monitoring for diabetes. So we used to, in the old days, we also used to, نفحص السكر, we used to prick it, but I think there's different things we use now.
Yeah, so now we have something called continuous glucose monitoring, and there's two different kinds. There's ones where it's like a sensor and you insert it like under your skin, and that can basically sense your blood sugar. Most of them will check the first kind, they'll check your blood sugar about every 5 minutes, and then you can import that data and have a look at it. There's a newer device called the Freestyle Libre, and that is what we call flash glucose monitoring. So it's still a little device. You'll see it if you've ever seen it. It actually sits like under in the arm, just about there. It's a little sensor in there with a little white device over the top of it, and basically that again keeps monitoring your sugar, and you can actually just check the reading just on that, so without having to prick your finger at all, which is quite life-changing for a lot of diabetics, particularly the type 1s who depend on that to adjust their insulin and that kind of thing, which is really, really cool that you can do that. Then there are also, with the first class, there are some devices that actually link in with insulin pumps and then can adjust the dose of insulin depending on that. The Freestyle Libre doesn't do that, unfortunately, but it does reduce the need for finger prick testing, which is pretty cool.
Dr. Rami, there is some people who complain of overweight, and the diabetes it's come as a result of overweight. They're thinking about the bariatric surgeries to remove or maybe avoid the diabetes or prevent it. So this can work, and once the patient done the bariatric surgery and lost a big amount of weight, is this enough for him to get rid of all the medication and get rid of diabetes or not?
I wanted to say two things about bariatric surgery, because there's a lot to talk about bariatric surgery. Number one, if you think bariatric surgery means you can eat what you want and live the lifestyle you want, don't have bariatric surgery. دي مشكلة. Okay. مش هيحل كل المشاكل. In fact, we have people عملوا العملية المعدة or bariatric surgery, خسوا after they lost weight after 2 years, بعد كده رجعوا تاني وأكتر كمان. They actually lose and regain all the weight again. That's number one. And number two, if bariatric surgery requires الإنسان لازم يروح للدكتور كتير. You have to go to the doctor every at least 3 months or 6 months. You have to get blood tests. You have to take your multivitamins. And you have to and there's also complications. Sometimes the sugars, if you have diabetes and your sugars are high, after you lose a lot of weight, the opposite can happen. Your sugars can go low, even on no medication, no tablets. Some people بعد العملية بيجي لهم حموضة كتير. بالذات الأصل المعدة ده sleeve في 3 أنواع السيرجي we'll talk about. And lots of other side effects. So it's not the easiest route. In my opinion, we always stress lifestyle, we always stress weight loss, and in fact, if you have diabetes, if you lose 15%, you can avoid diabetes altogether, and it can go away. But if that doesn't work and you're on a lot of medication, surgery is very powerful. The people who have surgery are very committed. They're exercising every day. They listen to the doctor's advice. They take their medication and they try their best to eat healthy. If this is you, please think about bariatric surgery. If it's not you, don't think about bariatric surgery, honestly, because it's going to be more trouble than it's worth. As far as the surgeries, there's 3 main types. There is the band. It can be المعدة, but we don't do the band much anymore. Lots of people are getting it taken out. More and more بنعمل sleeve gastrectomy اللي بيقصوا 3/4 من المعدة, so 3/4 of the stomach they remove. وفي انواع اسمه البايباس. Think of the M4 bypass, the new RAM. في انواع. في الميني بايباس هو اسمه اوميجا لوب ميني بايباس, وفي البايباس اسمه روين واي. It's a bit more involved. So في 3 انواع, the main ones we have in Australia. Now there's a 4th one coming down in a few years' time. I won't talk about that today. But they're very powerful tools. So speak to your doctor if you think you're very committed to make this work. Of course, the cost is an issue. So if you're thinking about it, maybe take up private health insurance, or ask your hospital that's in your area about it, whether or not they offer it. Some programs that they do offer it in the public.
Well, we came to the end, and we thank you so much, Dr. Rami and Dr. Marina. Thank you so much for all the very beneficial information that you have given us. Thank you so much for that. That's all right. مشاهدينا احنا وصلنا لآخر جزء من حلقتنا النهارده. الحقيقة حابة أتكلم عن احنا ليه بنقدم حلقات خاصة بالجوانب الصحية أو الجوانب الطبية أو حلقات صحية. ده الحقيقة إن إحنا في وقت دلوقتي إن كل إنسان المفروض إن هو يهتم بنفسه وبصحته، بيكون عنده حد أدنى من المعلومات الطبية والصحية عشان يحافظ على نفسه ويحمي نفسه من أمراض كتيرة ممكن تحصل له. أظن ده وقت مناسب إن إحنا زي ما إحنا شايفين اللي بيحصل حوالينا كلنا محتاجين كلنا يبقى عندنا وعي طبي وصحي، ونحاول إن إحنا ننقل المعلومات الصحيحة لكل حد. الحقيقة الحلقة الجاية هنتكلم فيها عن الوعد أو العهد اللي ممكن أعمله مع ربنا. Next episode is going to be about vows. Do they work? Vows with God. And we're very, very happy and very pleasure to have a very valuable guests with us. Abuna Yaqub Magdi and Dr. Daniel Ishak will be our guest next episode. Thank you for watching us and see you next week.